Good evening, viewers of HTV. Once again, I'm Maiga David Mark. I work with the Star Medical Center, Chizungu, Mbarara City, located in Chizungu, opposite Nyamitovola Police Post, Mbarara City. Today, I still have a chance to talk about urinary tract infection. I chose this topic after having had so many clients suffering from urinary tract infections. And our viewers today, allow me to give you an in-depth conversation, talk about urinary tract infections. A highlight about it, these are infections of the urinary system. They are basically caused by a bacteria, most commonly Escherichia coli. These infections run from the urethra to the bladder and affect all the parts of the urinary system. It is actually divided into two parts. We have the lower urinary tract infection and the upper urinary tract infection. Basically, the lower urinary tract infection commonly infects the bladder, and it is called cystitis. The lower urinary tract infection, it is basically the infection of the bladder, and it is called cystitis. Then the upper urinary tract infection, most commonly called pyelonephritis or the kidney infection. Basically, on the introduction, these urinary tract infections can occur at any age of life, basically in the after 20s, commonly in ladies, but you'll find even children are not ruled out, and even people above 50 are not ruled out. So being common, they can come at any stage of life. Then 95% of these infections are bacterial, where you find bacteria multiply at the opening of the urethra, then go up to the bladder and up to the kidneys. You'll find the urinary system is composed of so many parts. We have two kidneys, one in the right flank, the loin region, and the other in the right region, loin region. Then from the kidneys, those kidneys play an important role where they filter waste products, water and salts from blood in order to form urine. So what they have filtered, that is urine, go to the bladder through the tubes called ureters. From the ureters, urine collects in the bladder, and once the bladder is full, the muscles in the bladder contract to force urine out of the body through the urethra. So you'll find we have like 5 parts of the urinary tract system. We have the two kidneys, we have the ureters, still there are two, one in the right and the other in the left. We have the bladder, and we have the urethra. So usually the kidneys form urine. It goes to the bladder through the ureters, and at the entry of the bladder, the ureters enter at the entry of the bladder. You find they prevent the backflow during when the bladder squeezes urine out of the body through the urethra. You find that the ureters are designed in the way that they prevent backflow of the urine into the kidneys, which can also cause infections. So you find this urinary tract system, the urinary system, has defensive mechanisms against bacteria, like the immune system. It is composed of so many things. So you find the body itself can fight against the bacteria or against the UTI. You find urine itself is an antiseptic. Actually, urine is sterile. It is very free from bacteria, very free from fungi, and very free from viruses. You find in the form of urination, you find urine washes out all that from the body. Then the ureters also, that was the first mechanism how this system tries to fight the bacteria out of the body. We said one, you find urine is an antiseptic. An antiseptic means it is against bacteria, it is sterile, it is free from bacteria, fungi, and virus. So in the process of urination, it washes out all harmful bacteria out of the body. Then secondary, the ureters, they join into the bacteria, into the bladder in a matter where you find at the entry of the bacteria, there is a way they are designed that prevents the backflow of urine. You see, when urine flows back to the kidneys through the ureters, it can also cause invasion of the bacteria in that system. Then even the prostate gland secrete infection-fighting mechanisms as substances. The prostate in men, you find the prostate secretes some substances that help us to fight against diseases. Then thirdly, in healthy women, I find women, the vagina is colonized by the lactobacilli. It is actually protective bacteria. It secretes hydrogen peroxide. This hydrogen peroxide, it prevents, actually the hydrogen peroxide eliminates harmful bacteria from the urinary tract system. You find when the lactobacilli secrete when the lactobacilli secrete the hydrogen peroxide, it actually prevents the harmful bacteria from getting attached to the vaginal walls. So that is another defense mechanism. Even the immune system defense and antibacterial substances in the mucus lining of the bladder also prevent the invasion of the system with the bacteria. Then next on the agenda, we have the risk factors. So like I told you from the start, I think from our previous meeting, you find we have so many practices we do, and these practices actually cause us to be more susceptible to get some infections. So likewise, the urinary tract infection, you find people do some activities that predispose them to get these infections. So for a case of UTIs, the urinary tract infections, I actually chose to group these risk factors in the different categories of people. So you will find women are more susceptible to get urinary tract infection compared to men. Why? These are some of the reasons why these women are more susceptible to get infections, the urinary tract infections. You find in the anatomical structure of women, of the urinary system, women have got a very shorter urethra, which is actually approximately 1.5 inches, compared to us men who have a longer urethra that is 8.0 inches approximately. So you find we are almost 5 times longer than that of a woman. So in that case, women are susceptible to get urinary tract infection. So the other thing is frequent intercourse. Depending on how this practice is done, if women are really if women frequently play sex, they increase their risk of getting infections. It depends on how this practice is done. You find in most cases, these microorganisms can easily cross from the vagina to the urinary tract system, and hence they are so harmful there. So even the other thing, women have a tendency of using contraceptives, spermicides, and the diaphragms. These are family planning methods. You find these are chemicals that have different ingredients, of which some ladies are so allergic, they can cause formation of different rashes that can easily turn into urinary tract infections, or can easily make them more liable to get urinary tract infections. So the other risk factors about ladies, you find menopausal ladies. These ladies who have actually reached an age where they cannot have their menses anymore. We call them menopausal ladies. During menopause, there is a thinning of the lining of the UTIs due to the decrease in the levels of estrogen. And when the lining is actually thinned, it predisposes ladies to getting UTIs. As I said, during menopause, there is a decrease in estrogen level, hence causing thinning of the lining of the thinning of the lining of the urinary tract system, hence predisposing them to getting UTIs. Then the other thing, pregnancy. All pregnant ladies, you will find here at the facility, we usually receive pregnant ladies suffering from UTIs. Pregnancy alone is not a risk factor to UTIs. But how does it come about? So you'll find in most cases, pregnancy just increases the risk of having asymptomatic bacteriuria. So asymptomatic bacteriuria is very common among pregnant ladies, where you find someone has a significant number of bacteria in the urine, but they, in actual sense, do not have any symptoms suggestive of suggestive of a urinary tract infection. So many of the pregnant mothers once gotten with symptomatic bacteriuria that is actually seen on test of urinalysis. When you do a urinalysis test, you'll find they have bacteria in urine that is called asymptomatic. Asymptomatic means they do not have any symptoms and signs suggestive of a UTI apart from having bacteria in urine. So once you land on a pregnant mother having bacteriuria, asymptomatic bacteriuria, those people need to be treated promptly and see they recover in time, as this asymptomatic bacteriuria can cause severe symptoms and hence turn into a serious urinary tract infection in ladies. Then the other group, those are some of the risk factors that predispose ladies to getting UTIs compared to men. We talked of the shorter urethra, we talked of the menopausal ladies, we talked of the contraceptives and those other things like diaphragm and spermicides. We talked of the frequent intercourse, pregnancy, and actually lastly antibiotic use. So you'll find ladies who usually who are fond of using antibiotics, especially self-medication. These are things that kill the lactobacilli, the important bacteria in the urinary tract system of ladies. You will find this is a protective bacteria, and once you recurrently and you repeatedly use antibiotics, they end up eliminating lactobacilli that is supposed to protect those parts from these harmful bacteria. And once it is eliminated out of the system, you find these ladies recurrently get UTIs. Then the other group is men. You see, like I said, women are at a higher risk, but that does not rule out the fact that men do not get UTIs. So we also have a factor that increases our risk of getting UTIs. Which factor is that? So you find any man above 50 years is more susceptible to get a UTI. Why? After the age of 50, you find men start developing prostate issues. For example, benign prostate hypertrophy, where you find the prostate increases in size. And remember, on the anatomy of the urinary tract system, the urethra that lets urine out of the body is actually surrounded by the prostate in men. So once the prostate enlarges in size, in case of a benign prostate hypertrophy, it actually shortens the radius of the tube that is passing through it, that is the urethra. You find these men will complain of issues connecting to letting out urine. They will have dribbling of urine. They may even cause delayed emptying of the bladder, where you find once the urine overstays in the bladder, it ensures, actually it facilitates growth of microorganisms that can turn out to be harmful and cause a UTI. So men, that is one of the factor that makes men more likely to get a UTI, and this usually comes after the age of 50 in the case of a benign prostate hypertrophy that reduces the size of the urethra, hence causes hesitation in letting out urine. So basically that is the risk factor in men. And the others is the other group of people. We had women and men, and then we have children left. Oh yeah. So it is actually very rare. Yeah, UTIs are very rare in children, but you'll find in case they are there, they are more common in boys than girls. So ladies, especially children in have UTIs, rare condition, but more common. Once it happens, it is more common in boys than girls. So sometimes you'll find that many of the risk factors in children are anatomical structures, abnormalities. I'll give you an example of vesicoureteral reflux, where you find there is backing up of the urine through the ureters, where the muscles where there is dysfunction of the muscles at the entry of the bladder from the ureters. If those muscles that prevent the backflow of urine get a dysfunction, or if they have any structural abnormality, that will cause urine building up in the ureters and causing a kidney disease. Hence, makes children with such an abnormality of VUR, vesicoureteral reflux. Reflux is flowing back. So if a kid has vesicoureteral reflux abnormality, then that means urine, they will not be able to empty the bladder in time, and hence urine can flow back, causing a build-up of urine in the kidney areas, and hence once urine builds up and stays there for some time, it facilitates growth of microorganisms that can be harmful and eventually cause urinary tract infection in children. Then still about the risk factors, allow me to briefly hint about the medical conditions that can cause UTIs, that can increase the risk of getting a UTI. One of the conditions, we have always had clients here of diabetes, both type 1 and type 2, complaining of recurrent UTIs. You'll find that once someone is really infected with diabetes, urine contains glucose. And remember, these microorganisms feed on glucose. So every time we have uncontrolled levels of glucose, and hence they can actually appear in urine, it will facilitate the growth of microorganisms by providing energy from glucose, and hence that person is likely to get a UTI. Then kidney issues. For example, people who have undergone surgery, kidney transplant, can actually, someone has had a kidney transplant, they are also liable to get a urinary tract infection. You find kidney problems like kidney stones can also increase the risk of getting a UTI. Then the other medical condition is a neurogenic bladder, where you find the nerves and the brain and the nerves have issues that will actually bring about the poor connection and contraction of the muscles in the bladder, and therefore you cannot empty. So if someone has a neurogenic bladder, where you find the bladder cannot connect to the brain to let out urine, those people will have problems with their urinary tract system. Then the other thing is people who have a compromised immunity, people who are battling with chronic illnesses. Commonly we have HIV patients, HIV/AIDS patients. You find those people, their immunity is really down, and it is really very hard for a body to fight, for a body itself to fight urinary tract infections. Then the other group, we have people who are undergoing cancer treatment. You find these people, their immunity is completely down, and this increases their risk to get UTIs. Then the other thing is the other medical condition that can increase the risk of getting a UTI. We have urinary tract abnormalities. For example, I'll give an example of a cystole. A cystocele is where you find the bladder is actually bladder prolapse. The bladder is coming out. So that one forms tiny pockets called diverticula in the urethra wall, and these can be bleeding places for bacteria. They find such abnormalities can increase the risk of UTIs. Then the other thing, I think from the risk factors, allow me brief you about the signs and symptoms of UTIs. When should someone think that I think I've seen this and this, I might be having a UTI? So commonly for UTIs that have not yet gotten complicated, people will have a strong urge to urinate frequently. Someone like even the bladder, if you have just previously emptied your bladder, you feel you have the urge to go back and urinate. These are people who urinate like so many times in a day. The other thing is painful or a burning sensation on letting out urine. And the other one is discomfort, pressure or bloating of the lower abdomen. That one can also cause. That one can also be a symptom of a urinary tract infection. Then you find people will also complain of pain in the pelvic region, or even the back, lower back pain will also be a sign of a UTI. Then the other thing is cloudy or bloody urine. Some people with UTI will come complaining of change in the color of urine. Then others will report bloody urine. This can have a very strong bad smell. Others will also present with fever, high body temperatures. Then those are some of the signs of an uncomplicated urinary tract infection. So still, this uncomplicated can still progress to form a complicated UTI. So basically, if the above signs I've talked about present for more than, actually if they persist for more than 2 weeks, then you're going to experience a severe or a complicated urinary tract infection. You have the feverish feeling, you have the nausea and vomiting. Some of the signs of the severe or complicated urinary tract infection. Then I'll talk about the types of urinary tract infection next. We have uncomplicated or complicated, depending on the factors that trigger the infection. Depending on the signs we have talked about, we can categorize the UTIs as complicated or uncomplicated. Then the other, we can have primary or recurrent. So for primary, that is when the UTI is happening for the first time, of course. And then recurrent, that is when the UTI has actually happened within 2 weeks after treatment of the previous infection. That we call it a recurrent. Or it can even happen within a year of the previous UTI. We call it a recurrent UTI. Then basically, to talk about uncomplicated UTIs, we have commonly caused by Escherichia coli, and you find it is more common in women than men. Cystitis is the inflammation of the bladder. It is the most common type of UTI. It is usually brief and acute, does not go beyond 2 weeks, and only the surface of the lining of the bladder is affected, but sometimes deeper layers, deeper layers of the bladder, all persistent, all chronic, can structurally abnormalities in the bladder can also cause a chronic uncomplicated UTI. So the other form of uncomplicated UTI is a pyelonephritis, that is a kidney infection. The upper UTI is the infection of the kidneys and the ureters. This is actually, it is also more common, and it is usually a complication of the lower UTI. So complicated UTIs, we have talked about uncomplicated, So allow me to talk about the complicated UTIs. Like I explained earlier, that it is complicated if the symptoms I talked about happen for more than 2 weeks. But usually what causes this, you will find a UTI will become complicated if someone has a catheter use, maybe in a hospital setting, or in dwelling catheters for people who visit the outpatient departments. Then in immunocompromised patients, still people will have a complicated UTI. Then even in structural abnormalities, where someone can have an obstruction or a cystocele, like a prolapsing bladder, still it can cause a complicated UTI. Then the other type of a UTI was primary or recurrent. Primary, it is happening for the first time, but allow me to talk about the recurrence. Recurrent UTIs, most women have had recurrent UTIs and uncomplicated, or even they have occasional recurrence. In smaller percentages, women have recurrences. For someone who has just treated and within 2 weeks it happens to recur, it can be because of treatment failure. If you don't get good antibiotics, still you can get a recurrence. So recurrence is basically categorized into two. That is a relapse. A relapse comes when you get an infection, a UTI, within 2 weeks of previously treating a same thing. That is a recurrent. Then reinfection, when someone has greatly improved from the symptoms of UTI and after some time you get the same symptoms. Then the other category is asymptomatic UTI, asymptomatic urinary tract infection. This is very common among pregnant ladies and people undergoing urologic surgery. Like I said, pregnant ladies will have bacteria in their urine, significant number of bacteria in their urine, but they will not tell you I am paining here or there. So that is asymptomatic. Even people undergoing urologic surgery, for example, prostate surgery, once we introduce an infection during the surgery, it can usually be asymptomatic. People do not present with basically symptoms of the UTI. So basically, what do we need to do to investigate a UTI? You will find we do so many tests, but commonly most of the clinics will order, or your doctor, after having all those symptoms, your doctor will order for a urine test, a urinalysis. So this urinalysis will actually isolate bacterial infection, bacterial UTIs. We shall find signs of the bacterial UTI on the results of urinalysis. Then the other thing, we shall do a urine culture, especially for someone who has had medication and there is little or no improvement. We need to order advanced tests, for example, a urine culture, where you find they will have to grow the bacteria and basically find which specific drugs will help us to kill the microorganism that is causing the UTI. So results of a urine culture will usually run from 7 days, actually 5 days to 14 days to be out. So another test we can do is a blood culture. Usually if there are signs that the infection has crossed to the bloodstream, or you find it is actually threatening those neighboring parts, we sometimes order a blood culture to rule out infection of, to rule out like a UTI in other parts. Then the other test we can do a cystoscopy. Cystoscopy will actually help us to determine how far the UTI has gone and the extent of damage. Then basically, once we have done all that, basically treatment of UTI will depend on the severity. Drugs will run right from 3 days to 2 weeks. Defined for people who have reached the extent of doing cultures, they will need longer episodes of treatment. So among the preventive measures of a UTI, like I told you, I think the best treatment of any infection is prevention. So what are some of the practices that someone can do to see that they avoid having UTIs? What can you tell a friend to do to avoid? How can you health educate a friend about UTIs, about the prevention of UTIs? So basically, we need general cleanliness, personal cleanliness, where you have to clean the genital areas. Actually, genital areas from front to back. And the other thing is you take shower rather than a bath. So that means you need to use a lot of water to rinse the system. The other thing is avoid wearing tight fitting pants, as this can increase the risk of getting a UTI. For ladies, avoid bathing oils, feminine hygiene sprays, douches, and powder. These have a lot of ingredients, and hence you can be allergic to them and cause different manifestations that can increase the risk of getting a UTI. And the other thing is choose sanitary napkins. Get used to using sanitary napkins instead of tampons, as this can actually bring about the risk of UTIs. Then the other thing, you need to drink a lot of water. Drink a lot of water, as this can rinse the system during a frequent micturition. It can rinse the system and decrease the probability of getting a UTI. And the other thing is, once you happen to see any of the signs of a UTI, you really need to go and treat it promptly. Early diagnosis and prompt treatment will also prevent the recurrence of UTIs. Thank you so much for listening to me and watching me. Urge you guys to always go for medical checkups. Star Medical Center is located in Chizung, along opposite the police post in Mbarara City. Bye.
You're watching AYIT TV.